Most women are told there's a hard cutoff for hormone therapy, and if you miss it, hormone therapy suddenly becomes dangerous and you're shit out of luck. That advice is oversimplified, and unfortunately, I've seen women in their 60s and 70s suffer unnecessarily because no one explained to them correctly. I'm Dr. Rena Malik, urologist and pelvic surgeon, as well as certified menopause specialist, and today we're answering a common question: when is it too late to start hormone therapy? We'll start by talking about why it's recommended to start hormone therapy younger, what happens if you start later, and most importantly, how to make the safest decision for your unique situation. The general guideline for major medical organizations is that hormone therapy is most beneficial when started within 10 years of your last period or before the age of 60. This is when your blood vessels are still relatively healthy, your heart tissue is responsive to estrogen, and your body can maximize the protective benefits. But that doesn't mean the door slams shut at year 11 or at age 61. What it means is that we have to calculate your risk and your benefit, and we need to be more careful and offer a personalized approach. During that first 10 years of menopause, estrogen helps maintain the flexibility of your blood vessels. It supports healthy cholesterol levels and protects your bones from rapid loss. When you start during this time, you are essentially maintaining your cardiovascular systems that are still functioning very well. When you start HRT more than 10 years after menopause or after age 60, research shows some important differences. The cardiovascular protection we see in younger women may not apply, and in some studies, there's actually a slight increase in cardiovascular events in older women who end up starting HRT for the first time. But here's the nuance that's missing. This isn't about age. It's about the health of your blood vessels and your cardiovascular system. If, for example, you're 62 and you've maintained excellent heart health, you don't smoke, you exercise regularly, and have healthy blood pressure and cholesterol, your risk profile is very different from someone the same age who has heart disease or multiple risk factors for heart attacks. Basically, we need to decide based on those risk factors. Now, if you're struggling with symptoms related to the genitourinary syndrome of menopause, which includes things like vaginal dryness, painful intercourse, urinary urgency, and recurrent UTIs, this can be treated at any age with vaginal estrogen. It is one of my most prescribed prescriptions because it's basically safe for almost everyone except for women who have active breast cancer. And that's because it stays local in the tissues and it doesn't significantly increase blood levels. So it is very, very safe. Also, if you're dealing with severe bone loss or osteoporosis, starting hormone therapy later in life can still provide meaningful protection against fractures. However, you want to weigh that benefit against other medical options like bisphosphonates, which you can talk to your doctor about. Now, a lot of people are talking about the hormone therapy for heart protection and dementia prevention. Now, there is absolutely receptors in the brain and the heart, and there is some data supporting that. It is still considered controversial and not a reason to feel left out if you didn't start hormone therapy. Now, conversely, if you started hormone therapy during that first 10 years and you've been taking it continuously, the data would suggest that you can safely continue it for as long as the benefits outweigh the risks for you. Okay, how do you make the decision? Should you start hormone therapy or continue it after 10 years? First thing you want to ask yourself is, what are your symptoms? If you're still having hot flashes and night sweats that are ruining your quality of life and making it difficult to sleep, if your vaginal symptoms are making it difficult to have sex or it's uncomfortable, these are very valid reasons to either continue taking hormone therapy or start hormone therapy. Second, take a look at your cardiovascular health. Now, this is non-negotiable, especially if you're thinking about starting hormone therapy later. You want to get a full assessment, blood pressure, cholesterol panel, maybe even a calcium score if indicated, and any other cardiovascular screening. If you have existing heart attack or have had a stroke, you need a discussion with your menopause certified doctor, and probably you want to avoid oral estrogen formulations. Third, what's your breast cancer history? If you have a personal history of breast cancer, you'll need to have a more detailed discussion with your provider. What are the options available and how does that change depends on a lot of different factors, like what type of breast cancer you had. Are you still on an aromatase inhibitor or tamoxifen, and what your symptoms are. Fourth, you want to think about how you're taking these hormones. This is where we can sometimes find creative solutions. Transdermal estrogen, meaning getting estrogen through a patch or a gel, has a lower risk of blood clots compared to oral estrogen, and so it may be preferred for people who are at higher risk, specifically for treating the symptoms related to the genitourinary syndrome of menopause, specifically vaginal dryness, discomfort, pain with sex, lack of lubrication, all those things. It comes in 3 formulations, a cream, a suppository, or a ring, and they all work great. Last thing you want to consider is, do you need progesterone? If you still have your uterus, as long as you're taking estrogen, you need to take progesterone to protect the uterine lining. Now, if you've had a hysterectomy, you don't need to worry about progesterone. Also, the good news is that micronized progesterone, which is bioidentical, you don't need to go to a specialized pharmacy to get bioidentical hormones, doesn't appear to carry the same cardiovascular risk as older synthetic versions. Now, if you decide with your doctor that HRT is not right for you based on your risk factors or timing or maybe side effects, then you can consider other options. For hot flashes, there's non-hormonal medications, things like venlafaxine and paroxetine, which can reduce hot flashes. There's also a newer medication called fezolinetant, which works on brain receptors involved in temperature regulation. It's FDA approved specifically for hot flashes and doesn't involve hormones. Of course, for vaginal symptoms, if you can't tolerate vaginal estrogen, you can consider vaginal moisturizers or lubricants. I tend to prefer longer lasting lubricants like silicone or oil-based lubricants. There's also an alternative option called intrarosa or vaginal DHEA, and even laser or radio frequency treatments that can stimulate collagen and improve the vaginal tissue's health. For bone health, everyone should be doing weight-bearing exercises, so lifting heavy weights, getting adequate calcium and vitamin D, and talk to your doctor about medications like bisphosphonates. And guys, no matter whether or not you're on hormone therapy, there are certain things which are just non-negotiable once you're going through menopause. One is maintaining a healthy weight, not smoking, limiting your alcohol or eliminating it completely, managing stress, and getting regular exercise. Bottom line, guys, when is it too late to start HRT? The answer is it depends. And you got to talk about your symptoms, your cardiovascular health, and your risk factors, and what your goals are. So what you need to know is there is an optimal window of starting hormone therapy, ideally within 10 years of menopause or before 60, but this is a guideline and not an absolute rule. You want to consider your cardiovascular health and obviously keep that as healthy as possible. And vaginal estrogen is great for managing genitourinary symptoms, especially recurrent urinary tract infections. And if you're already on hormone therapy and you want to continue it, as long as you're benefiting, you can safely continue. Make this decision with a healthcare provider, ideally someone certified by the Menopause Society, and they can help you weigh your risks and benefits. If you find that you're not clicking with your doctor or they won't have this conversation with you, make sure to check out a second opinion and check out the Menopause Society website to find a provider near you. If you found this helpful, please share this with one other person you think might benefit. And as always, remember to take care of yourself because you're worth it.